Asthma attack inhaler use emergency steps. This article outlines the essential steps for managing an asthma attack using an inhaler, including proper use, indications, and key clinical considerations. Overview. Asthma attack is a sudden narrowing of the airways, leading to difficulty breathing, wheezing, and potentially life-threatening symptoms. The use of an asthma attack inhaler, usually a bronchodilator, is critical in managing acute episodes. The inhaler delivers medication directly to the airways, helping to relax the muscles and improve airflow. Proper use is essential to ensure effective treatment and prevent complications. Pathophysiology/mechanism of action. Asthma is a chronic inflammatory disorder of the airways, characterized by the presence of mast cells and eosinophils, which release inflammatory mediators such as histamine, leukotrienes, and prostaglandins. These substances cause airway inflammation, mucus production, and smooth muscle contraction. During an asthma attack, these mechanisms are exacerbated, leading to bronchoconstriction and airflow obstruction. Bronchodilators work by selectively relaxing the smooth muscles in the airways, thereby improving airflow and reducing symptoms. Clinical features/indications. Asthma attacks typically present with symptoms such as coughing, wheezing, chest tightness, and shortness of breath. The attack may progress to respiratory distress, hypoxia, or even respiratory failure. Indications for using an asthma attack inhaler include the presence of wheezing, increased work of breathing, and signs of respiratory distress. The inhaler is most effective when used correctly, and it is important to assess the patient's condition and determine the appropriate treatment. Diagnosis/monitoring. Diagnosis of an asthma attack is based on clinical presentation and history. Monitoring involves assessing the patient's respiratory status, oxygen saturation, and vital signs. In severe cases, arterial blood gas (ABG) analysis may be performed to evaluate oxygen and carbon dioxide levels. Continuous monitoring is essential to detect any deterioration in the patient's condition and to guide further treatment. Treatment/management. The primary treatment for an asthma attack is the use of a bronchodilator inhaler, such as albuterol. The standard dose is 1 to 2 puffs, depending on the severity of the attack. In cases of severe asthma, additional interventions may be required, such as the use of a corticosteroid inhaler or the administration of supplemental oxygen. It is also important to ensure the patient is in a comfortable position, preferably sitting upright, to facilitate breathing. In cases of respiratory distress or hypoxia, immediate intervention may be necessary, including the use of a non-rebreather mask or intubation if required. Key clinical points. Key clinical points include the importance of proper inhaler technique, the need for rapid assessment and intervention, and the importance of recognizing the signs of worsening asthma. Patients should be educated on the correct use of their inhalers and the importance of carrying their medication. In addition, healthcare providers should monitor patients for signs of respiratory failure or other complications and intervene promptly. The use of an asthma attack inhaler is a critical component of managing an acute asthma episode and can significantly improve outcomes when used appropriately. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.